حيث يكون كل مصطلح في سطر لوحده. necrosis نحر death of body tissue due to disease, injury or lack of blood supply. apoptosis موت الخلايا المبرمج programmed cell death that occurs in a controlled and regulated manner. inflammation التهاب a protective local tissue response to injury characterized by redness, heat, swelling, and pain. hyperplasia فرط التنسج an increase in the number of cells in a tissue or organ leading to its enlargement. hypertrophy فرط التضخم an increase in the size of cells resulting in the enlargement of tissues or organs. atrophy ضمور a decrease in the size of an organ or tissue due to cell shrinkage or loss of cell mass. metaplasia الحقول / تغير نوع النسج the reversible replacement of cell type by another mature cell type. neoplasia تكوين حديث / ورم abnormal and uncontrolled cellular growth that forms a tumor. edema وذمة / استسقاء excessive accumulation of fluid in the interstitial tissue spaces or body cavities. congestion احتقان الدم passive accumulation of blood within a tissue due to reduced venous outflow. hemorrhage نزف the escape of blood from the blood vessels due to vascular rupture or damage. thrombosis خثار / تجلط داخل الأوعية the formation of a blood clot inside a blood vessel impeding normal blood flow. embolism انصمام / سدادة وعائية the blocking of a blood vessel by an unattached intravascular mass. embolus infarction احتشاء an area of ischemic necrosis caused by blocked blood supply to a tissue. necropsy الفحص التشريحي لجثة الحيوان post-mortem examination performed on an animal carcass. biopsy خزعة extraction of a small tissue sample from a living subject for microscopic analysis. lesion آفة مرضية / إصابة any morphological abnormality or damage found in a tissue or organ. metastasis نقيلة سرطانية the spread of malignant tumor cells from the primary site to secondary distant locations. exudate نتحة التهابية an inflammatory fluid containing high protein content and cellular debris leaking from vessels. transudate ترشحة غير التهابية أي non-inflammatory fluid buildup caused by hemodynamic changes with low protein content. suppuration تقيح the formation and accumulation of pus at an infected site. abscess خراج أي localized cavity filled with pus and surrounded by inflamed tissue. ulcer قرحة أي localized defect or excavation of the epithelial surface of an organ or skin. granuloma ورم حبيبي أي nodular inflammatory lesion consisting mainly of macrophages and lymphocytes. degeneration تنكس خلوي أي reversible sublethal cellular alteration resulting from injury or metabolic disturbance. ischemia نقص تروية الدم أي restriction or deficiency of blood supply to tissues. calcification تكلس the abnormal deposition of calcium salts in soft tissues. pigmentation تلون / ترسب الصبغات abnormal accumulation or distribution of pigments within cells or tissues. amyloidosis الداء النشواني أي disease characterized by extracellular deposition of insoluble amyloid protein fibrils. remission هجوع والنكي من cell suction انحسار المرض أي reduction or complete disappearance of the clinical signs and symptoms of a disease.